People are anxious to get a vaccine to help prevent the spread of COVID-19. But until there is one, people are taking whatever measures they can to reduce their risk. For some, that includes the use of vitamins and supplements. New this morning, our 10 News medical expert, Dr. Frank McGeorge, explains new research on one important vitamin.
We're talking about vitamin D. It was on the list of supplements President Trump was taking when he was diagnosed with COVID-19. And even Dr. Anthony Fauci has said he takes it to bolster his immune system. And 2 studies in particular support the idea.
A newly published study in the Journal of Clinical Endocrinology and Metabolism looked back at the vitamin D levels of 216 COVID patients admitted to a hospital in Spain. It turns out over 80% of those patients were deficient in vitamin D. That compares to about 47% of vitamin D deficiency in the general population that they had data on. The higher percentage of vitamin D deficiencies among hospitalized COVID patients suggests an association. However, they did not find a relationship between vitamin D levels and the severity of the COVID infections. Now, another study supporting the value of correcting vitamin D deficiency, published recently in JAMA, looked at 489 patients from the University of Chicago. These patients all had vitamin D levels measured prior to the COVID-19 pandemic. They found the risk of being diagnosed with COVID-19 was 77% higher among the vitamin D deficient patients compared to the patients with normal levels. There is good reason to believe vitamin D plays an important role in our immune response to viral infections. However, these observational studies don't prove that vitamin D deficiencies increase susceptibility to COVID infection. Nonetheless, given the mounting data, it is a good idea to correct any deficiency in vitamin D.
Now keep in mind, we're talking about vitamin D deficiencies possibly being a risk, not using vitamin D as a way to supplement your immunity. There is in fact no evidence that in the absence of deficiency that there is any benefit to getting extra vitamin D.